This presentation is going to be on the lungs. The lungs are a pair of spongy, pinkish-gray organs that are the primary organ in oxygen-carbon dioxide exchange, or better known as gas exchange. These spongy, soft, elastic organs always contain air, and they are located in the chest cavity, which is located in a thin membranous cavity called the pleura. The lungs can weigh around 2.2 pounds and can be anywhere from 9 inches when it's deflated to 10.5 inches inflated. It is roughly cone-shaped, and the boundaries include the apex, which is located above the first rib, with the 3 borders and 3 surfaces. The 3 borders are the anterior, the posterior, and the inferior. The anterior creates the cardiac notch in the left lung and also creates the pleural reflection. The inferior border, which is thin, separates the lung from the costal surface, and the posterior border, which is thick, extends from C7 to T10 vertebra in the spine, from apex to inferior border. In the image on the left, you can see in an elderly man that the lung is composed of 2 separate entities. The right lung has 3 lobes, the right upper lobe, right middle lobe, and right lower lobe. And the left lung has 2 entities, and that's the left upper lobe and left lower lobe. So air travels through our body, and it is inhaled through our nose or mouth. It goes down the pharynx, past the larynx, which is also known as the voice box, into the trachea, onto the bronchial tubes, next to the bronchioles, and finally the alveoli. The main purpose of the nose and nasal cavity is to humidify and warm inspired air. The main purpose of the pharynx is to route air down past the larynx and to move air into the trachea and the lungs. The main purpose of the trachea is to allow passage of inspired and expired air into and out of the lung. The main purpose of bronchial tubes is to distribute the air throughout the lungs until reaching the respiratory bronchioles and alveolar sac. The main purpose of the bronchioles is to deliver air to a diffuse network of around 300 million alveoli in the lungs. The main purpose of the alveoli is to pick up the incoming energy, or oxygen, that we breathe in and release the outgoing waste product, carbon dioxide, which we exhale. And finally, the diaphragm is included to help us inspire and expire. For surgical access, it is most commonly known as a thoracotomy, and it involves a large incision down the chest wall and opening the rib cage to access the lungs. There are a few different procedures that can be completed with the lungs. The first is a lymphadenectomy, which is the removal of lymph nodes surrounding the lungs. A wedge resection, which is a removal of a small section of the lung, but not an entire lobe or segment. Segmentomy is the removal of a segment of a lung, but not an entire lobe. A lobectomy is the removal of one of the 5 lobes that make up the lungs. A pneumectomy is the removal of an entire lung. And finally, a transplantation is a replacement of both lungs with a healthy donor lungs. For the blood supply to the lungs, there are 3 major categories that take it away and to the lungs. The first is the pulmonary artery, which takes deoxygenated blood from the heart to be oxygenated by the lung parenchyma. It emerges from the right ventricle and bifurcates into the left main and right main pulmonary arteries. It usually trails and expands along the branches of the bronchial tree and eventually become capillaries around the alveoli. Then the pulmonary veins, which receive oxygenated blood from the alveoli capillaries and deoxygenated blood from the bronchial arteries and the visceral pleura. The 4 main pulmonary veins come together at the right atrium. Finally is the bronchial arteries, which provide oxygen to the lung parenchyma. The left bronchial artery arises as 2 different divisions. the superior and the inferior, from the thoracic aorta. The right brachial artery usually comes from one of the following three: the right posterior intercostal artery, with the left superior bronchial artery off the aorta, or directly from the aorta. The bronchial veins collect the deoxygenated blood and empty into the azygous vein. The phrenic nerves come from the C3, 4, and 5 cervical nerve roots. It innervates the fibrous pericardium, portions of the visceral pleura, and the diaphragm. The lung receives innervation from the two main sources: the pulmonary plexus, a combination of parasympathetic and sympathetic innervation, and the phrenic nerve. The pulmonary plexus is at the root of the lung and consists of efferent and afferent autonomic nerve fibers. It consists of branches of the vagus nerve, which is parasympathetic, and the sympathetic fibers, the plexus branches around the pulmonary vasculature and bronchi. The parasympathetic innervation causes constriction of the bronchi, dilation of the pulmonary vessels, and increased gland secretion. The sympathetic innervation causes dilation of the bronchi and constriction of the pulmonary vessels. For lymphatic drainage, the superficial and deep lymphatic plexus drain to the lung. The lymph flow from the lung parenchyma first drains into the interparenchymal nodes and then into the peribronchial nodes. Subsequently, the lymphatics will drain to the tracheobronchial, the paratracheal lymph nodes, and the bronchomediastinal trunk, and then into the thoracic duct, where it will then be removed from the lungs. For histology, the pathologist looked for 5 major cell types: the ciliated cells, goblet cells, basal cells, brush cells, and neuroendocrine cells. This image, however, at low power, is of the lung parenchyma, and it shows the alveoli, blood vessels, and bronchioles, and each of those are labeled as necessary. For embryology, we have this image that breaks down all of the development in embryo of the lungs and the supporting structures. So in this image, we see the development of airways and arteries. The stages of the lung development, which are in blue, are correlated to the development of the airways, which are shown in black, and the arteries, which are shown in red. On average, an airway of a human lung ends in the alveolar saccule after 23 generations. However, due to the shape of the lung, a range of 18 to 30 generations has been observed. Preacinar arteries are formed out of the capillary plexus surrounding the growing lung buds, which is also known as vasculogenesis. Intraacinar arteries grow by angiogenesis. So in this image, we can see that the trachea is shown in the embryonic stage, which is 4 to 7 weeks. The bronchi, bronchioles, and respiratory bronchioles are in the pseudoglandular stage, which is 5 to 17 weeks. And the canalicular stage, which is 16 to 26 weeks. And the alveolar ducts and some more of the respiratory bronchioles are formed in the saccular stage, which is 24 weeks to term. And finally, the saccule and alveoli are formed in the alveolarization, which is 36 weeks to 21 years. For arteries and capillaries, we see that the extrapulmonary artery is formed at around 34 days. The lobular artery is around 44 days. The preacinar arteries is around 5 to 17 weeks. The intraacinar arteries are 18 to 25 weeks. The alveolar duct arteries are 25 weeks to 18 months postnatal, and the alveolar capillaries are 36 weeks to 21 years. For biblical implications, I chose 2 that really stood to me with the lungs and have everything having to do with creation and God of human beings. So the first is Genesis 2:7. Then the Lord formed man of dust from the ground, and breathed into his nostrils the breath of life, and man became a living being. And for Job 33:4, the Spirit of God has made me, and the breath of the Almighty gives me life. And to conclude, we have physiology. The lungs are foundational organs of the respiratory system, whose most basic function is to facilitate gas exchange from the environment into the bloodstream. Oxygen then gets transported through the alveoli into the capillary network, where it can enter the arterial system, ultimately to perfuse the tissue. And here are my citations.